So I just want to welcome you all. We haven't had a family forum in a while. So what I'm probably going to do is we'll try to go without muting everybody, but if I keep getting feedback or people that are talking, I'll mute everyone, and then you can unmute yourself. I'll periodically stop, and questions can be asked. Okay, so I'm going to mute everyone. And you can unmute yourself.
Hi.
You can unmute yourself when you want to talk. I'll talk a little bit, then I'll stop and ask for anybody if they want a response. So again, we haven't had a family forum for a while. We probably might have these at least once a month, probably a little more with the activity that's taking place. You know, we've done so well over the last 7 months or so, and now we're starting to see it's slowly increasing into our programs. We've been very fortunate up until the last couple of weeks. This last week, we have finally had a few people that have been positive, 2 people in Jefferson County that are in our residential program and 1 in St. Lawrence. And then in St. Lawrence too, we also had a couple people that received services in the community with day services only in our children and youth program that were positive. We also have, I think right now we're about 6 or 7 between the 2 counties staff. We've had an uptick in people that have had possible exposures. When that takes place, our nurses react very quickly. They put the house in a quarantine. They have direct contact with public health and follow their direction as they do contact tracing, and we assist in that process. In regards to what we're doing right now, this is causing issues with staffing because as we quarantine, we have staff that are in quarantine and can't work. So it's reducing our capacity. So right now we are isolating in place in the houses. We do not have the staff to go elsewhere. And we do not have the facility in Jefferson County to do that. We're fortunate in that the people have their own rooms and we're limiting them to their room, only coming out to go to the bathroom. We have adequate PPE. We have the gowns, the face shields, the head nets, the shoe covers, and the staff are wearing those as well as the face masks. We have the N95s, and every site that has been deemed positive has adequate supply of that. We have, prior to this, we had reduced last week only essential staff working in the locations, so no longer could support staff going to the houses, which means none of the QIDPs, none of the behavioral specialists. Maintenance is not even allowed into the houses unless there's an emergency that has to be fixed. So only the people that normally work in those locations are the ones that are going back and forth from home and work. Unfortunately, both counties, Jefferson and St. Lawrence, have seen a spike in the community. The numbers are very high. We continue to monitor people on a daily basis. Temperatures are taken, the questions are asked. They all wear face masks for those locations that haven't had a positive. One second, letting a few more people in. And our nurses are keeping very, very close in the situation and react accordingly. And like I said, we have close contact with both Jefferson County Public Health and St. Lawrence Public Health. Karen Jarvis takes care of St. Lawrence and Larry Mcgrath takes care of Jefferson County. And so far things are working out. We do have adequate supplies and we are ordering on a regular basis, at least a monthly basis, from the Arc of New York. As you can understand, it's difficult at times to get some of these supplies in a timely fashion. We do have an adequate stockpile, but we continue to order more so we have them in case we need them. We've been ordering through the Arc of New York, which allows us to buy in large quantity the PPE. And you know, things have gone up tremendously. Just for example, gloves, the medical gloves that we use, you know, where those used to be $20, $25 for a case, it's now over $100 for a case of gloves. We're looking at just on utilization for gloves alone, next 6 months, probably $100,000 increase in cost. But we need them. We have to have them. And everything seems to be going up in cost that's related to, because everyone's asking for it. We also use United Food Service Organization, our purchasing group, to get some of the supplies, and they've been able to procure those for us. The other thing that we are looking at is, we have also asked our staff to limit community outings as much as possible. Medical appointments are really the priority. Drive-throughs for food, no going into the restaurants, and to limit community outings to those large, the Walmarts, the Targets. We don't want people going to those right now. It's just, it's too dangerous really for the people that we have and the compromising health situations some of them have. We don't want this to occur. We're also looking at our day programs. We're operating it minimally in our day hab in Jefferson County. The majority of people are in the residences. We have one small site that operates with 10 to 11 people in it. We are closing that down effective tomorrow for a couple of weeks at least, and till we get a better indicator of what's going on in the community. And we're using those staff in a residential program, which is down. We're also going to be looking at up in St. Lawrence too, if we need to pull back for a while. We're operating a small group of people in Canton and a small group of people in Potsdam that go in, real small groups. And then we have our Norwood site that has about 20 people in it. So taking a close look at those locations if we want to pull back on them. Our work centers are still operating. We really haven't had any issues with them because they're large. People are wearing the protective gear and they're spread out so we can social distance with no problem. Again, every site that we have, we do the temperature checks. If it's a longer shift, we do them a couple times. We do regular hand washing, sanitizing. So I'm going to stop right there for now. It's a lot of information. I do have some of our directors and nursing staff on. So if anyone wants to ask a question, unmute yourself and go away. Or go in the chat room and ask a question that way. If you look in the bottom of your screen, you have chat and you can type in questions there or unmute yourself. Any questions?
Yeah, Howie, this is Cliff.
Yep.
I got a question, and I appreciate what you've outlined, and I agree. I said we're concerned here too about what's happening here in the community. With respect to updates, would it be possible for you to provide, on your website, a weekly update?
Yes, we're going to do that, Cliff. We have the website now, and Michelle Quinnell and her crew are going to put messages on there weekly. We'll start adding some of the OPWD guidance we get that changes. We'll put that in there also. So that will be updated on a weekly basis from now on.
And you know what, it's well, for me, at least as a member of the public and as a parent and stuff, if I just had the information, say, breakdown by county, because you've obviously got residences in St. Lawrence County and also Jefferson County, but also any cases that might occur with breakdowns by staff and those that are in residence as a general thing that we can just keep an eye on and see what happens. Yep. And if you do have in any of the residences, I think the parents would like to know where those residences are. I understand we don't want any particulars about an individual, but what residences are affected. Much the same as the schools now have got things where they break down in a particular school if they've got a case there, so they provide that information. But that'd be useful for parents. I know I very much appreciate that.
Yeah, we probably would let the family members know, but I don't know if I put that on the website for those locations. But I am providing data on a weekly basis. We track both staff and the people we support who are positive, who have been quarantined, who've been isolated, who are self-isolating. And we provide that data to the Arc of New York, who actually is providing that data to Syracuse University for a study on the impact for people with disabilities. And we do that for both our staff and the people we support. And that's the report that I will share on the website. That'll show you how many people we have positive, both staff and the people we support in those varying categories. We've had some staff that have chosen to self-isolate, and we'll identify all that.
But you're not going to provide anything with, for example, for we parents here, a particular residence in which you've got someone that's tested positive. Don't you think that that would be an important thing for us to know?
Yeah, I think we'd let the family members know directly, not necessarily put it on the website.
You'd notify parents directly, is what you're saying?
Let me ask the question. Lori, have we done that, now, or Lynn?
Yes, so we would have to notify you because your family member would be quarantined. So we would make you aware of that.
Yeah, but would you make a parent aware if someone else within the same residence was tested positive? So we would know that someone else in that residence. Are you going to let us know?
Yes, because we would have to let you know that your family member is in quarantine.
Yeah, they'd obviously be in quarantine if they're in the same residence.
Right.
Yep. So we would make you aware.
We would isolate, quarantine the person, and the other staff, the other individuals would be quarantined, period.
Now, would there be a regular regime of testing for those individuals? If there was someone who tested positive in a residence, do you have some sort of protocol that you're going to be testing regularly? Or you're just going to wait for someone to come up with some symptoms or so that...
That's basically what I think. Lori, you want to talk about that a little bit? You're on mute. You have to mute yourself. Thought I saw her on here. 1 second.
Howie, she's on.
Howie, if she can't speak, I can attest to what our procedure is.
Thanks.
So currently, if we have an indicated case of COVID at one of the sites, each of the providers, the primary care providers, are contacted for each person in the household, and we seek their guidance on if they want them tested, if they want them watched for signs and symptoms, and we follow the direction of either the provider and the public health advice. So that's the procedure right now. And everybody is monitored at least twice a day for signs and symptoms and temperatures, and we log that in and provide it to public health for their monitoring.
We are, Cliff, looking at coordinating with someone for testing. Up in St. Lawrence, we have a relationship, we're forming a relationship, we have a management agreement with the Community Health Center. We're going to start out with our bus drivers that do public transit because of their exposure. We're going to test them first, but we're also going to look at them for staff or the people we support with symptoms. And we're going to be looking at having a relationship with an organization down here to do the same thing. Lynn's had some discussion with the Community Health Center, and we'll be looking to form a relationship, possibly in Jefferson County too.
Yep, so I did reach out to their executive director today. So they're willing to work with us and schedule appointments in advance for our employees and people we support, should we need to have testing done.
I have a question.
Yes.
The concern I have is that people who are not showing symptoms are the ones who are spreading it. And I am concerned that that our people, our family members and the staff are only going to be tested if they show symptoms.
Well,
And
not necessarily. They're getting tested if they've been exposed too, even if they don't have symptoms.
Because I'm concerned because Derek's house has had an exposure, and I'm Laura Davis, Derek's mom. So,
Yep.
So I'm just concerned because they're quarantined now, and
Well, there's a difference between a quarantine and an exposure. So, for example, the houses right now, if someone positive had been in the house, it depends. They evaluate, how close they were to the people, If it was a family member that came in, for example, were the other people exposed? So there's a different criteria, I guess, in evaluating that.
Okay, well, it was a staff member that tested positive that works in Derek's house.
Yep.
I mean, I don't know who it is, but I mean, I
So
hope they're going to be okay, but
So some of the reassurance, from our perspective is that we require our staff to wear the mask. And we are looking at using shields and masks, especially in a house that has been exposed. So looking at multi-layers.
Yeah, for most of our locations, we know it's probably going to be brought in by staff because our people are very restricted in regards to where they go, what they
Right.
do, who they see. So we're trying to put additional protections in for this on the staff end, so we limit spread. It's all, it's really a direct relation to the community spread that's out there right now. The numbers are just so high. Every day you see the 50, 60 people. It's just it's heart wrenching. We're very concerned, and we have a lot of people that are medically compromised.
Oh yeah, my son is one of them. So I'm just, I just want, I just want to hear all the right things,
I mean, you have a nurse that's there,
Yeah.
that location, and Lori is assigning some of our nurses to the houses, some of the houses that she feels are important. That's the only place they'll be going, is staying with it. They'll be part of that staff cycle because of our limitations on restricting people going to the houses. So that there'll be nurses in some of those locations that we worry about. I mean, ideally, we'd remove the person that was positive. We don't have the staff for the site to do that right now. So we're doing the best we can to isolate. So far, it's working with the people that are positive. We'll have to look at that on a case-by-case basis. But I can tell you that the staff are very cognizant. They did the signs and symptom checks, the temperature checks, and I think we're doing the best we can, and so far we've been successful in protecting the majority of people. We've had some exposures that have been brought in by staff.
I just want to say that this has been a rough year for all of us, but and I just want to say that I think that you've done a fantastic job keeping it away this long. I really thought we'd see it a lot sooner than this, and I know everybody has done a really great job, and I'm so proud of everybody for all of the efforts that they've made.
Yeah, the staff have done great. So the other thing that we've done to, try to incentivize a little bit and recognize staff in these houses, because they are going to be under some additional responsibilities, is they're getting an extra $2 an hour during the COVID period as a way to recognize them for that.
That's great. Well, thank you.
Howie,
this is Jackie, and I have a question. Some of us were distressed to see that the OPWDD guidelines about staff who had been exposed or tested positive for the virus did not require that they leave their position during that period. What's the protocol of our organization?
Well, right now we're following OPW guidance. If the person has been exposed, has a negative test, or has no symptoms, then we are able to bring them in to work as long as they wear the masks, the face shields, those things. If we have a staffing need in that location, if it's critical. If it's not critical, then we would not bring them in.
Thank you.
We have to provide enough staff to provide protection for the people we support. We'll do the best we can to limit exposures, but there may be cases that there's not enough staff to cover a location, because what's happening is, not only is someone's exposed, they're quarantined for a period of time. And when a whole house is quarantined, and you've got several staff that are off for a while until we hit that window, it becomes very critical. And that's why we're looking at closing some of the day program sites down for a while to not only provide additional protection, but to also provide additional staff for the residential locations, because we are getting to a critical point. We have, and Tara can comment on this, but we were averaging about 30% vacancy rate, and this is just going to compromise that even more. Our staffing, we still are hiring staff, but we're not seeing the numbers that we traditionally do pre-COVID. We might hire 5, 6, 7 people on a given month, where before we were doing 10, 15. So that's hurt a little bit also. Someone's asking about community pre-vote right now. Yes. Go ahead.
Lori's in the waiting room. If Lori's in the waiting room, if you could let her in case.
Not up there. Okay.
No?
Here she comes.
Okay.
So someone's asking about community pre-vote right now. We have no restrictions there. We are limiting, the contact in community, but they are a volunteer. They just look closely at the sites they can do things. And we do have a location in downtown Watertown, and we have a location up in St. Lawrence, a couple locations that we can go into the site for protections in Bristol in the community, but they may not be they're limited in regards to what they can do, but they're still providing services in that regard.
And we're not doing as much of group settings, more one-on-one.
Okay, so just to talk about a few other things, I want to talk a little bit about work centers too. So the work centers, if anyone's aware of, we have a 14C certificate that allows us to pay subminimum wage for people who have, based on their productivity. Both of our work centers, I think the average wage is about $5 or $5.35 an hour. With the new administration coming in at the federal level, there are quite a few of them that are against the 14C. There also, it was looked at in New York State last year, and it didn't go through. But the writing's on the wall that federal legislation is in place, both at the House and the Senate at the federal level, to repeal 14C. Now, right now, we have between the two counties, I know there's about 20 in Jefferson, and how many's in St. Lawrence? Do you know, Lynn?
Under the 14C?
Yeah.
I think there's 20.
Okay, so about 40 between the two counties. Those people, we would not be able to pay them minimum wage in order for them to continue. So those jobs would probably be lost, and we'd have to look at other alternatives. But I will say that, I'm on a Source America committee that's working on 14C and making some recommendations to the legislation. We're looking at it being spread over a 10-year period. We're looking at money being tied to the person in the work center to support versus it going to the state to administer. We're looking at a category of people that could still be in kind of a site-based pre-vote program and maybe get some type of subsidy or stipend for that type of work. So there's a variety of things that we're working at still. This is down the road a ways, but I just want to give you some information that we'll be asking you for advocacy in New York State and maybe even the federal level as we move forward in this. It's in the infancy stages right now, but Source America is supporting that legislation. But again, it'll be a period of time before it's implemented, and we're looking at ways to make it work for people. Personally, there was an article that came out last year by the Commission on Human Rights. They really slammed 14C, and they look at it more as a social injustice than they do that this is an opportunity for people who would not be able to work otherwise based on their productivity in a community-based setting. So we're hoping to come to a compromise so we can allow that to continue. The other thing that I just want to make people aware of, we do have a bed bug issue in 4 of our locations in Jefferson County. We have it under control. As soon as we discovered it, we hired Eric to go in and do, who we worked with before, to do the remedies to getting it taken care of. And those locations are pretty much, I believe, doing very well, and we have limited exposure right now with bed bugs. It's something that periodically has occurred in both Jefferson and St. Lawrence County, and it was brought in by, we believe, from the community, people going home and visiting, or maybe being in locations in the community where they might have picked it up. But we've addressed it. We're pretty much professionals. We have a couple staff that are professionals here and probably could form a company of their own because they know so much about it now. And we react on it very quickly. We are developing the budget for 2021. I will tell you it's going to be a very challenging budget for next year. We already know that we have cuts in our residential program based on the vacancy adjustment not being paid for anymore with a 5%, allowed up to 5% vacancy adjustment. We are being paid half our rate for therapeutic leave dates when people go home, up to, I think it's 96 days. And we are also being reduced for retainer days and hospitalization, 14 days, and paying at half our rate. All those things equate to a rather, between that and the 20%, it's over $1 million cut. The other thing the state has done is a 20% withhold for any state 100% funded program. I believe, that's not going to continue forever because we cannot continue to provide the same service at 80%. And we are working with the ARC of New York for some pushback on that. They've got some great ideas on filling our vacancies and also looking at reorganizing how those calculations are done for retainer days and therapeutic leave. So we also are losing our long-term sheltered workshop funding in December and our direct sheltered workshop funding. Those two things together are about $500,000 plus. But we are, Lynn's working on ways to make that up, and we are looking at those people going into our site-based pre-voc that were in those programs before, which will make up a significant amount of that. And Lynn, if you want to talk a little bit about some of the things that we're trying to bring into the work centers for additional jobs.
So we have an opportunity working with a local food vendor where we'll be repackaging some fruits and vegetables, different canned vegetables. It'll give people an opportunity to repackage them. They'll buy them from us and we'll redistribute them out. We also are doing a trash liner where we're repackaging trash liners and redistributing those back out as well.
Thank you. So Tara, do you have anything else you want to add a little bit about residential? Do we have
what's that?
Do you have anything else that I might have missed that you want to talk about, or are you good to go?
No, I just want to reassure everybody that, we are doing daily check-ins with each of the sites, reminding, staff, masks are so important, even though, we all kind of get careless from time to time. So there is a daily call going out. We are reminding staff of safety procedures, hand washing, cleaning, and we're checking on supplies each morning to make sure that we are, holding steady. This is for both Jefferson and St. Lawrence County. So they get sick of us calling every day, but they'll get used to it again since we've re-implemented that. And just, I know Laura had a few comments about a staff being positive at a site that her son is at, and trust and believe that I speak to the nursing staff more so than my loved ones at home now. And everything is based on levels of exposure, how often a person who potentially could be positive is around another person. We try not to be around somebody more than 10 minutes at a time, because that's the risk level. If you're within 6 feet, more than 10 minutes, that's when the risk level elevates. So we really try to socially distance at the sites as much as possible. It's hard because folks love their staff. They're used to giving them hugs. And it's hard for our staff to not be able to be that compassionate with them on that level that they are used to. But be reassured that the residential management team is reaching out every single day, ensuring that our staff are following safety procedures. And if you guys ever have any questions, feel free to reach out to Christine Lozon in St. Lawrence, Kirk Thomas in Jefferson, or myself, or any of the coordinators.
Thanks, Tara. A few questions on 14C. So right now we have a group, I'm chairing a group in New York also with all the ARCs. We actually have a meeting next week. We are doing a survey to gather information, a variety of things such as average wage, average number of hours worked, how many people it would impact directly if this took place across the state, what other programs would those people go to, and what would be the cost of that compared to the program they're in right now, because vocational is the most cost-effective program of any of them that we operate. So once we gather that, we're working with some other provider groups too, such as the Alliance, and we're working with Source America, and we will come up with an advocacy format that will be reaching out to family members to take part in that, and who you would need to contact in a writing or calling the legislators. All of our local legislators, both in St. Lawrence and Jefferson, support us. They know the importance of 14C. But we'll get that information out as we gather it and work towards turning this around, or at least extending it for a long period of time so we can prepare for it. Hopefully 8 to 10 years. All right, Lori Mcgrath, can you get on yet? And you want to say a few things about what you've been doing? Now, I've never known Lori to be this quiet.
She said her phone has frozen up. She can see us, but she can't talk.
Okay.
Hi, can you hear me now?
Yes.
You got it.
Okay. I've had a lot of contact with Jefferson County Public Health as well as New York State Department of Public Health. They tell me the things that we should do. We follow it. Lots of staff right now are wearing N95s and face shields. That's what public health has suggested, and those are the things we're doing. Don't worry about PPE supplies for any of the staff or any of your family members, because I have hoarded stuff, and part of St. Patrick's Gym is covered with PPE supplies, so we're good there. We're calling every day as well. Like Tara said, I think she and I talk more now than I can ever remember talking to anybody. It's great to work with a good team that we both know the things that need to do. If one doesn't get it done, the other does. So we're taking care of folks. Nurses are out there. If they can't hit the site, they're calling every day. So we're working. Really, that's it.
Okay. So just so I'll share some information, my report today to the ARC of New York. So number of people supported under DOH or physician-directed quarantine isolation between the two counties, 5. Number of people supported currently under agency-implemented quarantine, which means if someone might have been exposed and the nurses quarantine that location, I count them in this number, even though there might not be a positive. There's 58. Nobody that we support under travel advisory restriction. Total number of people under some form of isolation or quarantine between the two counties, 63. Number of people with current confirmed COVID-19, when I did the report, it's 2. It's now 3, I believe. Hospitalizations, none. Deaths, none. People that have recovered to date, there's none in that number yet, because this is our first instance of people we support. In regards to employees, those currently under DOH or physician-directed quarantine between the two counties, 11. Number of employees under self-imposed quarantine, 6. Nobody under quarantine for the travel advisory. Total number of employees under quarantine or isolation since the last survey, 16. Number of employees with current confirmed COVID-19, it was 4 at the time I did this. Nobody hospitalized, no deaths with staff, and total number of employees recovered to date, 5. People that have had it in the past. And then we, I know you might not be interested in this, but for our total number of people that are receiving day services between the 2 counties is 492, which is about 73%, 72% compared to pre-COVID. How many people are receiving services in day services in our residences? 291. How many people are receiving day services in site-based programs? 126. How many people are receiving services within our community settings? 93. We just had our first couple cases of COVID in our day services, and those are up north in the community-based programs. So that's the data. I will have Michelle post that on the website tomorrow, and that's the report that you'll see every week. I do the report by 2 o'clock on Thursday. We'll have it posted by Friday on the website. And as you know, the team stated, those family members who have an individual that lives with us that we support that are impacted by a quarantine or positive, you'll be getting contacted directly and alerted to that fact. Okay, I don't have anything else to say. Any questions that people want to ask?
Howie, I have another question. As we move towards thinking about vaccinations, have you heard anything specifically from OPWDD or the Department of Health or anyone about whether the people we serve, especially those who live in group homes and congregate care, will have high priority in receiving vaccinations?
Preliminarily, we've heard that we're going to be on phase 2. That could change because there's already been a lot of advocacy. We feel we're similar to a nursing home. People are compromised health. So we're looking to be in phase 1. Laura, you want to talk a little bit about the vaccination? If you can get back on your phone.
I actually attended a webinar yesterday in regards to the vaccines. As Howie said, we're high on the list to receive them. We will have consents that go out before we give them. We're also attempting to apply so that we can provide the vaccines. That's something that came about last week, I think, and if that way the nurses can give it. Either that or we're also working with our local pharmacies, both up north and here, to see if they can help us with that. So actually Bolton's Pharmacy are already saving some for us. So vaccines right now, it looks positive for us.
But there are lobbying efforts to try to move us up to the phase 1, right? Is that something that families should be involved with here?
We can share that information on the website too. I think Anchor is one of the ones that's federal organizations, national organization that's looking for this. But I'll look at my emails. The ARC might be part of that also, and put that information on the website.
Great, thank you.
So we are, as Lori said, we are looking, we're contemplating if we're going to apply to provide the vaccine to our staff and the people we support. There are some chapters in New York City that are already doing some of the testing. They've contracted out to do that. But it has to be open to the public also. So we have a good relationship with our pharmacies, and they've been very helpful in the flu, just doing the flu shots, and we probably follow the same format with the vaccines that we do with the flu shots. Anybody else from my team that wants to? Oh, somebody's asking, are we at risk of losing visitation again? Yes. It all depends. Right now, we haven't stopped it as long as we can isolate the family member. with their family member in the home. But if we continue to see a spike, that's probably going to end. And then we'll have to go back to similar, where if the person goes home, they'll have to go, Tara's got the form that has to be filled out with information on it. We're looking at if someone's home more than 3 days, we may request a test before they come back. But we haven't got there yet. We're looking at how the environment changes. It's very fluid right now. We're trying to get a handle on it as much as we can, but there is a possibility that could happen. Just to make sure we're safe, the people we support are safe. Okay. We're also recording this and we'll put it on the website also. Michelle, did we put it on the website or we put it on Facebook? I can't remember.
It will go on our YouTube channel and we can share it on Facebook so everybody knows how to access that.
Okay. All right. Thank you very much. Everybody have a good evening and we'll be in touch. We'll probably try to schedule another meeting in the next 2 or 3 weeks before Christmas.
Thank you.